So now I don't know why my our recording keeps on getting interrupted. So that is going to inconvenience us. So let's try to move as quick as we can. Where were we on the afterload? The factors that can result into high afterload or low afterload. I did mention of the precues, the constriction, the contraction of the smooth muscles, and the last one is the stenosis of the valves. It can also contribute to stenosis. All right. So now, having mentioned about all of that, so basically what we're doing is just to understand these part that makes up the cardiac output. Now, let's understand now what is the cardiac output and the total normal cardiac output. So let me get my pencil here. So here in lead, it's the formula for the cardiac output. Cardiac output is equal to stroke volume times the heart rate. So if you are sharp enough, it is good at saying as cardiac output is equal to EDV minus the ESV times the heart rate. But of course, that is that is too much. You can end up getting confused. So now, let's assuming to say from our stroke volume, we had this 70 mils beats per minute, and our heart rate is 72 beats per minute. So now, one thing that you notice here, we have 70 mils beats per minute and we have 72 beats per minute. So we can cancel beat per beat. So I mean to say, if you cancel the beat in the stroke volume and you cancel the beat in the heart rate, what you're going to remain with is 70 mils times 72 minutes. When you do that, the answer that you're going to get to do the multiplication will be 5,040 mils per minute. So now from the basic conversions, you can convert the mils into liters just for the simplicity sake. So you know to say 1,000 mils is equal to 1,000 liters, and here you have 5,040 mils. So you can do the conversion. When you do the conversion of converting mils to liters, what you're going to get will be 5 liters, 5 liters per minute, meaning to say this amount of blood that you are pumping out per each and every heartbeat. You are pumping out 5 liters of blood, or 5 liters volume of blood per minute. So that is the normal cardiac output. So I believe with everything being said, I've done the whole of this 66 PowerPoint slide, because I've mentioned about everything. So what influences the SV, what influences the heart rate, we've totally mentioned about everything here. You know what the preload is. So basically, um, let me just tackle some of the things that I did mention, and some of those things include these laws, such as the Frank-Starling law of the heart. So the Frank-Starling law of the heart, you have to know what does it state, what is it all about. Okay, so the Frank-Starling of the heart, in simpler terms, what it states is that it states that the higher the EDV, the higher the stretch, or the higher the stretch of the preload will result. And as a result of that, it will result into high stroke volume. So it is just basically a relationship with the higher the EDV, the higher the stretch of the myocardium. Okay, as simple as that. So there about should be three or four laws rather that you need to know when it comes to the cardiac output. And we've just mentioned one, which is the flank, the flank Starling law of the heart. So that is one. Okay. So it is just basically the amount of stretch that is just within the contractile myocardial fibers, and this amount of stretch, it is in relation with the EDV. So it can only stretch if the EDV is high. If the EDV is high, it will result into the stretching. So the amount of stretch within the contractile myocardial fibers in relation to EDV, that is the Frank-Starling law of the heart. Which other load do we need to consider? So I've mentioned about this, the preload that will affect the preload, the skeletal muscle pump, the respiratory pump, the arterial suction. So maybe for the respiratory pump, what the respiratory pump is that during inspiration and during the respiration, you don't the amount the volume rather of the abdominal cavity and the volume in the thoracic cavity, the thoracic cavity must not be the same. So during respiration, you expect the volume in the abdominal cavity to be high as compared to the volume in the thoracic cavity, or because here we're using the principle that things likes to move from the area of higher concentration to the area of the lower concentration. So as a result, from the abdominal cavity where we have too much higher pressure to the thoracic cavity where we have the lower pressure, and finally from there it will drain into the heart, and that is via the inferior vena cava. So the pressure of blood in the abdominal cavity will be higher than the pressure in the thoracic cavity, so that we can follow the rule of things moving from the higher concentration to the lower concentration, so that this blood can move up to the thoracic cavity and finally through the inferior vena cava into the heart. If at all we have the thoracic cavity pressure being higher than the abdominal pressure, that is basically going to hinder the venous return of blood. And as a result, if you hinder the venous return of blood, that is going to affect the preload, because you have less blood pouring into the ventricles, and that will hinder our preload. Our skeletal muscle pump. So skeletal muscle pump, this is the activity of the sympathetic nervous system. So from the skeletal muscle pump here, these skeletal muscle pumps, the parasympathetic, as a result of the acetylcholine and the stuff, they can contract, pushing blood upward. All right. So the preload, it will follow this Frank-Starling law of the heart. So as simple as that. Which other law do we need to talk at? Do we need to look at? Contractility, I've mentioned about it. What causes the contraction? So the larger the stronger the contraction, the larger the slope volume. I've mentioned about it. And what are some of the anotropic agents that will result into high contractility? I've mentioned about it. The epinephrine, the norepinephrine, the digitalis. Maybe I haven't mentioned about the digitalis. And we've mentioned about the acetylcholine, it being the negative anotropic agent. So these ones are direct forward. So now this is just a table that is showing us how the epinephrine and the norepinephrine of the sympathetic nervous system is going to stimulate this contractility. And we've mentioned about it, we've repeated about it so many times. The afterload, we've mentioned about it, and what is the normal afterload, the volume and so forth. All right, what is left to talk about with regards to cardiac output? I believe we've done everything. So the blood flow and the blood pressure controls, these are straightforward. So at your own time, you can just go through these, understanding how the blood flow and the blood pressure controls, how they occur and so forth and so on. So we'll not waste time teaching you how this blood circulation, how it goes in and out. So these are simple physiological stuffs that you need to know. The difference between the kind of blood that is carrying in the vein, in the blood vessels, and the type of the blood vessels that we have. So when you say the veins, we have what you call the larger veins, the medium-sized veins, the venules, and the least ones being the capillaries. These are simple, guys. You did these. I just want to talk about one law, which is what's the name of that law? It's very hard to pronounce. It's the Solius law. Okay. We've mentioned about all of these. So the blood pressure, what. So let me just go on and okay. I think this also high yield for your exam. But again, I don't think if you guys can go into details by looking into these factors. So now remember, where are we coming from? The general formula for the blood pressure, which was equal to cardiac output times the total peripheral resistance. We have broken down what the cardiac output is and the formula for the cardiac output. And the part that we did not mention, it was for the total peripheral resistance. So now, the total peripheral resistance, this is the resistance that will be affected by several things, such as number one, the radius of the blood vessels, number two, the length of the blood vessels, number four, the viscosity of the blood. So now, let me get my pen here and show you what I mean by the length, the viscosity, and the stuff. So we said blood pressure is equal to cardiac output times the total peripheral resistance. So guys, this is straightforward. If you want to find what is the total peripheral resistance, if you've been given the blood pressure, you've been given the cardiac output, just make your total peripheral resistance be the subject of the formula. And how do you do that? You just divide here by the cardiac output on both sides, cardiac output. What are you going to remain with? You remain with total peripheral resistance is equal to, so now at this point, that will be the change in the blood pressure or the change in pressure divided by the cardiac output. As simple as that. So if a question comes asking you to calculate for the total peripheral resistance, this is what you are supposed to do. So now in it can also be like changed a bit. They cannot just bring it in the direct form like that. And that is the reason why we need to understand what this total peripheral resistance is, some of the factors that can contribute to the total peripheral resistance. And what are those? So the total peripheral resistance, let me just choose P represent, R for the total peripheral resistance is equal to the, so I'm writing the formula here for the, is equal to the 8, I want you guys to follow this formula nicely, NL divided by pi radius to the power 4. So now this is what is the total peripheral resistance is. So the question can be tricky. You can be given these values, which is going to represent for your total peripheral resistance. So now let me be easy with you here. We said blood pressure is equal to cardiac output times the total peripheral resistance. If the question is direct, you are given the value for the blood pressure, you are given the value for the cardiac output, and you are asked to calculate for the total peripheral resistance. Just to make the total peripheral resistance be the subject of the formula. And then you just replace with the values of the figures that you've been given for the blood pressure and for the cardiac output. But in a case whereby you are asked to calculate for the blood pressure and you've been given the cardiac output and you don't have the total peripheral resistance, or let me just say the total peripheral resistance is given in terms of this figure here. What you are supposed to do is you are supposed to pick out, you are supposed to use this formula to find the total peripheral resistance. So what does this formula says? The total peripheral resistance is equal to change. So 8, it is just a constant number. N in this case represents the viscosity of blood. L here represents the length of the blood vessel. Pi, you know what pi is and you know what is the normal value for the pi. It can either be in the decimal form, which is 3.14, times the radius. So this radius, it is the radius of the blood vessel. Now, note to say these values for the N, viscosity, for length, and for the radius, they are supposed to be provided for you in the question. If at all the question is asking you to calculate the blood pressure and you have not been given the actual total peripheral resistance, they want you to calculate it for your own. This is the formula that you are going to use. And what is the conclusion that you can make from this formula? The conclusion that you can make from this formula, it is that the higher, if the value of N is high, which is the viscosity, if the viscosity is high, it will result into high total peripheral resistance. And if the length of the diameter is high, it will result into the total peripheral resistance. So meaning to say, if the total peripheral resistance is very high because of high viscosity and high length of the blood vessel, the high total peripheral resistance will result into what? Into high blood pressure. And the opposite is true. If you have high radius here, the value for the radius, if it is high, that will do what? Would result into having low total peripheral resistance, and that will result into having low blood pressure. As simple as that. So this is a formula that you need to know concerning the total peripheral resistance. You can calculate it directly, or if it is not direct, if these values are given in the question, replace these values and find the value for the total peripheral resistance. So that is what we mean. So if the radius is high, that will result into what? Into low total peripheral resistance. All right. So this is what we mean by the conductance and the resistance. So here is a very, very, very good law. So the formula that I had written for you, it's for the Solius law. I don't know how you can pronounce this, but whatever it is the Solius law. And what this law actually states is that it states that the rate of blood flow is directly proportional to the pressure difference and the radius of to the power 4 and inversely proportional to the viscosity and the length of the what? The length of the blood vessel. So now, what does this tells you? So this is coming from the velocity flow. I know we did not talk about the velocity flow, but actually this is the velocity flow of this is the velocity flow of what? Of the velocity flow of the cardiac output. So in other literatures, you'll find a formula written as the velocity is equal to flow divided by area. So this flow divided by area, this our flow, it can be represented, it's the same as the cardiac output. So instead of us putting what is F, we put F, we can replace it with the cardiac output. And from the Solius law, what it states that it is the flow of blood, which is directly proportional to the pressure difference and radius, and inversely proportional to the viscosity. So if it is inversely proportional, what we are just basically doing is that, remember our normal total peripheral resistance, it was total peripheral resistance is equal to what? Is equal to the change in the velocity multiplied by the length divided by the pi radius to the power 4. So the inverse of this is what we are referring to as what? The Solius law. So it is just basically the inverse proportion of the total peripheral resistance. The opposite of that will be what we are referring to as the Solius law. So if the inverse proportion of this means to say we're just changing what was here on the bottom will become will go on top, and what was on top will become the bottom. And as a result, what do you get? You get this formula that we have here. So if you look at this formula, it is just basically the same with what we're from looking under the total peripheral resistance formula. And the inverse of that is giving us the Solius law. All right, so that is what we need to know. The law of the law of Labs. This one is direct forward. So I think with that being said, some of these things, I don't think they are high yield for your exam. What is high yield for your exam? It is what I've spent so much time talking on the cardiac output. So with that being said, I think we can end this lecture here. If at all there is any questions, you are free to ask. You can come to my inbox, you can ask in the group, and we'll be able to do it. I'll be able to attend to the questions. But for the cardiac output, that is what you need to know. Did you talk about the clinical correlates of it? So the clinical correlates of it, one of them being edema. Some of them I talked about them when we're dealing with the sympathetic nervous system. So go back to the sympathetic nervous system, and some of the conditions that are in there, they will still be what? They can still apply under the cardiovascular physiology. And in there, we had looked at some of the conditions that are found in the sympathetic include the spinal cord lesions, the brainstem, okay, so forth and so on. So just go back to that, and you'll be able to understand what these conditions are. So with that being said, I'm sure we can end here. If any questions, you are free to ask, then we'll be able to respond. If at all there's any part that you haven't understood, please come to my inbox, then I'll be able to clarify where you need clarity. Or maybe there's a part where you need to add on, you're free to do that. So that explanation was just basically based on my understanding. If you use a textbook, they'll give you more advanced information. So I advise you to start so that you can be ahead of things and understand things. Otherwise, with that being said, I wish you all the best for the paper that you're writing on Monday, Physiology. Believe me, the questions on the cardiac output will be there to test you on your understanding on the cardiac output. So, as I did mention, it's not only about the cardiac output, and also some other things that makes up the whole of the cardiovascular physiology. So just make sure to say your mind is open, it is fresh, and you are able to think widely and connect all the information at once and being able to connect the dots. Otherwise,